should be fine now. I guess when they start speaking, they have slides, so then I guess we can.
Okay, if you want it to be off, just press off. Otherwise, right now. Okay.
Hi everyone. So my name is Kuntol Chaudhary. I'm a third-year IB student here at UC Berkeley, and I'm the president of the UC Berkeley CAPSA chapter, sponsoring today's debate. CAPSA, as you can see from our lovely banner on the ground, stands for California Health Professional Student Alliance. CAPSA aims to cultivate leadership and advocacy skills among health professional students like many of yourselves to increase health equity primarily through grassroots efforts, education, and chapter growth in support of a comprehensive, publicly financed and privately delivered guaranteed health care for all Californians. We have 15 chapters across the state in several major medical and health graduate schools such as UCSF, UCLA, and UCSD. So if today's debate intrigues you, please give us your email address on the note cards that are being passed out to you. Also, please raise your hand if you didn't receive a note card. We'll be asking you to write questions related to the debate later on. So if you didn't receive a note card, please raise your hand. So the purpose of today's debate. In light of recent healthcare reforms, the topic of health economics is often brought to the forefront. In recent years, costs have increased, quality has been inconsistent, and more Americans have joined the ranks of the uninsured. In today's debate, we will explore a proposal for a new funding mechanism, the single-payer system, as a solution to the problems in the status quo. We hope you will leave with a better understanding of the current situation and various approaches that can be taken to make our current system more affordable, accessible, and efficient. The resolution for today's debate is single-payer health insurance is superior to market-based insurance. Now to introduce our wonderful speakers. Dr. Paul Song will be speaking for the affirmative. Dr. Paul Song is a board-certified radiation oncologist and a board member of Physicians for National Health Program in California. He is on the faculty at Samuel Ocean Cancer Center at Cedars-Sinai Medical Center. Dr. Song attended the University of Chicago, where he graduated with honors and received his medical degree from George Washington University. He completed his residency in radiation oncology at the University of Chicago Medical Center. Recently, Dr. Song was named the very first visiting fellow by California Insurance Commissioner Dave Jones to help with the healthcare policy in the California Department of Insurance. He serves as the executive board member of Liberty in North Korea, the Courage Campaign, and People for the American Way. He also served as co-chair of the Asian American Finance Committee for California Attorney General Kamala Harris. He was a frequent contributor to Larry King Live during the healthcare reform debate and is a regular contributor to Extra TV for cancer-related topics. He currently resides in Santa Monica with his TV journalist wife Lisa Ling and their daughter Jet. Dr. Beth Haynes will be speaking for the negative. Dr. Beth Haynes, after 20 years in private practice in emergency medicine, board certified in both family practice and emergency medicine, now works full-time in healthcare policy. As of September 1st, 2012, she became the executive board director of the Benjamin Rush Society and the senior health policy analyst and executive board member for Docs for Patient Care. Her research on cost shifting was instrumental for 2 amicus briefs submitted to the 11th Circuit Court of Appeals and to the Supreme Court on behalf of the plaintiffs challenging the constitutionality of the individual mandate. She is additionally on the board of directors of the Dr. Joseph Warren Institute and until recently was the national co-chair of its Doc Squad, a project to recruit and train doctors to lead the public healthcare debate. Dr. Haynes began her career in health policy as the founder and president of the Black Ribbon Project, which promotes freedom of choice for patients and doctors. Dr. Haynes has several op-eds published in townhall.com, PJ Media, and The American Thinker, and frequently speaks to citizen and professional groups on healthcare policy, the ACA, and the ethics and economics of medicine. So the debate today will be conducted in the Oxford format. There will be 2 speeches by the affirmative and negative sides, followed by 4 rebuttals. Then we will have a question and answer session where we encourage the audience to think of questions to ask our speakers to facilitate the debate. These questions will be written down on the note cards that were passed out to you and collected after the first set of rebuttals and then once again after the second set of rebuttals. These questions will then be asked to our speakers during the question and answer section of the debate. Also, if you would like to receive more information about CAPSA, please write your email address on the note cards we've passed out to you. Now, before we begin the debate, we want to ascertain your position on today's resolution. If everyone can take out their iClickers, we will begin. So this is a resolution for today. Single-payer health insurance is superior to market-based health insurance. Press A if you agree, B if you disagree, and C if you're undecided. 10 more seconds. So as we can see, a great many of you are undecided, and we hope this debate will give you a certain standing and a certain understanding that will help you make your decisions in deciding which side you support. Now to begin with the affirmative, I'd like to introduce Dr. Paul Song.
Before we start, I just want to thank you all for allowing us to come and share this interesting discussion with you all. Also would like us maybe to all take a minute to just think of the people in Boston. I don't know if you heard about the bombs that went off today during the Boston Marathon, but pretty tragic. So when you get a chance today, just take a minute to really keep them in your thoughts. That'd be great. So I wanted to start out with just a discussion of where we are in terms of our healthcare system and why I think single payer is really the way to go. About 20 years ago, I graduated from medical school, and C. Everett Koop asked us to raise our hands. He was the Surgeon General at the time. And how's that? Can you? Okay. So about 20 years ago, I took this Hippocratic oath. C. Everett Koop came and asked us to raise our hands, and one of the lines in it that still sticks out to me this day is, "I will follow that system of regimen which, according to my ability and judgment, I consider for the benefit of my patients, and abstain from whatever is mischievous and deleterious." And that's exactly what we have right now in our current healthcare system. Just a few facts. We spend 2 times as much on healthcare per person as any other industrialized nation, and yet we still have 50+ million Americans who are uninsured and 75 million Americans who are grossly underinsured. And 28,000 people die in the US each year simply because they're uninsured. If you look at healthcare costs in the United States, we're the orange line on the very top, and all the other nations, it's not even close. At one point, in 1970s, we're all about the same, but now we're spending, as I mentioned, twice as much. And what do we get for that? We get 50+ million uninsured. It's interesting that the cost curve matches the uninsured curve. You would think one would go in the opposite direction. So not only is the uninsured issue a major problem, last year there were over 4 million bankruptcies in the United States, and 2/3 of those were due to a medical illness. And out of that, 75% of those people that went bankrupt due to medical illness actually had insurance. How does that happen in our society? Part of the reason is that patients are expected to spend more and more money out of pocket, and we spend more out of pocket than any other industrialized nation. And one of the things that you've heard all through the healthcare debate is we have to go back to more of a free market system, let the free market rule. There is no free market in healthcare. I think that's something that Dr. Haynes and I will agree on, that there are only 2 industries in the whole United States that are exempt from antitrust legislation: Major League Baseball and the health insurance industry. And generally what happens is that in most of the major markets, it's controlled by 1 or 2 insurers. Blue Cross Blue Shield Association currently covers 100 million Americans in the US, and in some states like Alabama, 90% of everyone living in Alabama who has insurance has Blue Cross. United Healthcare, which is another big group, has 50% of the total insurable population. So you can see we're all beholden to basically 1 or 2 major insurers in the United States. And many of these big companies, and especially individuals like us, we're really powerless when it comes to negotiating with the insurance companies and providers. CalPERS, which in any given year is the pension for the entire California system, is either the first or second largest purchaser of private health care in the United States. But they couldn't negotiate better premiums than the average, than each of us. 10% was the amount their premiums went up in 2012. So if a big corporation or a big purchaser like CalPERS can't negotiate rates, how can we? And the other thing I would say is when you're sick and you need emergency surgery, it's really hard to negotiate a price at that particular time. This is just showing you what the average price is for an appendectomy in the United States versus every other industrialized nation. And again, if your appendix bursts, you can't sit there with a doctor and haggle over price. This is just showing you angioplasty. This is showing you bypass. And I'm going to have to go a little bit fast because I want to talk specifically about single payer. So one of the things you also hear is freedom. We need more freedom. Well, currently you have a system where the insurance companies dictate to patients what doctor you can go see, what hospital they can go to, what medication they can take, but Medicare doesn't do that. Insurance companies tell doctors what tests we can order, what procedures we can do, and what medications we can prescribe, but Medicare doesn't do that. And many people are currently stuck in their job only because of the health benefits that they get. They hate the person they work for, but instead of being able to go anywhere and start their own businesses, they're beholden to stay with the company that they're at because of healthcare benefits. That's not exactly a free system. So when you hear that the insurance that the government comes between you and your patient, it's absolutely not true in the United States. It's the insurance company that's consistently coming between us and patients. And just in California alone, there were 45.7 million denials in California in the last 9 years. So the other thing about the insurance industry is their average profits have risen 428% over the last 5 years alone. And this is just showing you the CEO salary for the big corporations. This is just showing you the profits. And this is really what happened. So Congress became beholden to the insurance industry. And this is, again, showing you how much money each congressman got from the pharmaceutical industry. This basically shows you that healthcare reform process exposes corporate influence. And basically, this healthcare reform, which we both agree is bad, was a gift to the private insurance industry. It wasn't exactly socialism. It was more like corporate welfare. So what did we get for that? Still, there were 30+ million people that are uninsured. So I would ask you, why are we spending so much and getting so little? Part of the problem is that the private insurance industry takes 31 cents of every dollar actually out of healthcare that's used for overhead sales, exorbitant salaries, billing, lobbying, and that waste is estimated to be $400 billion a year. And one of the things you hear about is that the government is inefficient. When it comes to healthcare, the private industry is inefficient. This is just showing you the number of administrators that have grown from 1970 to now versus the number of doctors. So one of the things we find is that this costs the doctor's office about $70,000 a year. So a single payer system would basically take all of that administrative waste and put it back into the system. And it would basically be everybody in, nobody out, a continuous pool where everyone would have access to healthcare. They could go to see whichever doctor they wanted, go to whatever hospital they wanted. Doctors would be able to prescribe the way they wanted and practice the way they wanted. The patients would have more freedom to choose their physician, hospital, and treatment, and we could save $4 trillion a year over the next 10 years alone with a Medicare for All program. Okay, so the other thing I just want to point out, because you're going to hear, is that this is just showing you the difference between Canada and the US in terms of costs. Canada enacted their single-payer system in 1971. Shows you the billing administrative costs are much less in Canada. The overhead expenses are less. Insurance overhead is less. Life expectancy is better. They have better outcomes for heart attacks, stroke. And the other thing I just want to point out is that the wait times are not what you hear. Other than needing a hip replacement for emergent things, the wait times are the same. And final thing I want to just show you is physicians in Canada actually do just as well, if not better, than doctors here in California. So a lot of what you hear about Canada is absolutely not true. This is data from 2012. Just showing you what, and finally I'll just show you the last thing is that physicians that are in Canada don't come to work in the United States anymore. If anything, more doctors from the United States are going to Canada to practice because it's a better system. And with that, I'm sorry I had to speed through it, but I just think that when you look at the administrative waste that we spend on healthcare that goes to the private insurance industry, and yet we still leave 50 million people uninsured, there is a much better way, and that way is single payer.
Now to introduce Dr. Beth Haynes.
Don't put my first slide up. Am I on? Can you hear me?
Are you awake? Okay, I'm going to go ahead and start because I don't use my slides till the very end. Market-based health insurance is unequivocally superior to single payer. It's superior from a practical standpoint. It's also, more importantly, superior from a moral standpoint. Now, to set the framework for your listening, I want to share an important principle that I learned while studying economics. It comes from the economist Henry Hazlitt. It's a principle that's pertinent not only to economics, but to ethics and politics as well. So this is it. The art of economics consists in looking not merely at the immediate, but at the longer effects of any act or policy. It consists in tracing the consequences of that policy not merely for one group, but for all groups. So as we look at single payer versus free market as ways to finance healthcare, remember that the effects that you have with healthcare policies on financing are going to go way beyond just healthcare. Examining the single payer versus market-based healthcare insurance is just one example of the much more fundamental issue of government interference with free enterprise. And to understand what creates success and what creates failure in an economic system, we have to understand those fundamentals. Besides, what we're really interested in is not preserving some particular form of how to finance healthcare. What we're concerned about is human flourishing. We're ultimately concerned about our individual flesh and blood living human beings. So what socioeconomic system maximizes human flourishing? What system consistently respects the autonomy and the dignity of each individual? You can look across time, across countries. The history and data are clear. It's a political economy of free markets. And that's because free market system is the one that most consistently respects individual rights, the most fundamental of which is the right of each individual to his own life, but only to his own. Now, what do I mean by a free market? It's simply the application of individual rights to the realm of economic exchange. An unfettered free market is not unfettered from individual rights. Rather, a free market is very strictly constrained by the equal application of these rights to every group, to every subgroup, and to each and every individual. Capitalism, properly understood, does not permit anyone to lie, cheat, or steal, or to ask for special favors from government. Free markets are the system that insist upon voluntary social interactions. It's uncorrupted equality before the law. It's the right of each individual to his own life and only to his own. And those are the foundations of a truly peaceful and benevolent society. So when we start comparing the US healthcare system to other developed countries, it's important to note that every single one of these countries has a mixed economy. It's a mixture of government control and free market. A free market exists nowhere on earth, and certainly not in healthcare in the United States. And the United States isn't even the freest economy in the world anymore. According to the Economic Freedom of the World Index, we're 18th. We fall behind not just the Asian miracles of Hong Kong, Taiwan, and Singapore. We're also behind Switzerland, Australia, Canada, and the United Kingdom, and even the so-called socialist Scandinavian countries of Denmark and Finland rank higher in economic freedom than the United States. Something to think about. So just as we are a mixed economy we are mixed in our general economy, we're also mixed in the way we deliver health care. But every single country, France, Germany, Switzerland, Canada, Great Britain, all of them are a mixture of private and public components for the delivery of health care. So given this mix, we have to ask what's causing the dysfunctions. And there are dysfunctions in every single healthcare system. We need to know what leads to unnecessarily high costs. What causes lower than desired quality? What brings success and prosperity? The free parts of the market or the government controls. Supporters of single payer want to credit government with the successes of these mixed systems and blame the problems on free markets. In fact, just the opposite is true. And rather than try and tease apart all the incredibly complex and varied mixtures of freedoms and controls that exist in each country, I want to take a look at the broader data comparing human well-being with the degrees of economic freedom. So what do I push to advance? The arrows? Oh, there we go. Okay, so this graph, now I gotta find my place in here. This shows you the economic freedom plotted against per capita income. The freer the country, the wealthier its citizens. But we're here to talk about health. So this graph plots per capita income against life expectancy. All the countries over here, they have the shortest life and they're the poorest. And the countries way up there with the longest life expectancy and the highest per capita income, those are also the countries that have the greatest economic freedom. So the freer, the wealthier, the healthier. And not just the wealthy are better off in a freer economy, but everyone's better off. This graph shows what percentage of wealth is owned by the poor of each country grouped according to the level of economic freedom. There's not a lot of variance. The poorest 10% get about 2.5% of the country's total income, whether it's free or it's unfree. Free markets do not cause increased economic inequality, and government controls don't lessen it. But that's just looking at a relative basis. What about absolute? It makes a huge difference if you're poor, whether you're in a free country or one that's controlled, tenfold, and that's a matter of life and death for most people that are in these least free. So I used my time in this segment to talk about the practical aspects of the role of free markets in creating the abundance that we need to have in order to create affordable, reliable, quality healthcare in everything, with healthcare just being one part of a larger economy that prospers in free enterprise. And for my next time slot, I'm going to talk about the moral superiority of the free market.
So one of the themes that was just mentioned was the idea of economic freedom, and it was interesting that all the industrialized nations that she mentioned that were ranked ahead of the US, we were ranked 18th, actually have a universal healthcare system in there, particularly Hong Kong, Singapore. And part of the reason that maybe these countries have more economic freedom is because they are freed from spending 17% of their GDP on healthcare costs. There was a study in 2009 by the Rand Corporation that found companies with high employee health benefits had much slower economic growth than those with lower participation. And I would just say that the late Margaret Thatcher, who just passed away, was a huge free market person, huge person in favor of capitalism and economic freedom, but she championed the National Health Service in Britain. I would just say that with regard to basic rights, Thomas Jefferson said that we all have a right to life, liberty, and the pursuit of happiness. Protecting these rights are the function of government, he claimed. So when we think of too many people that are dying of illness that medical science has long found a cure for, or going bankrupt simply because their health insurance is too expensive or inadequate or too expensive, or treatment without insurance costs too much, this is where the government should step in and protect the right to a healthy life. I think that if you look at corporations, most business CEOs would love to have healthcare insurance costs removed from their books. Most governors would love to have Medicaid costs removed from their state rolls. Just think of the amount of additional jobs you could create if a company didn't have to spend all their money on healthcare benefits for employees. They could pay higher wages. They could invest more in capital infrastructure. They could hire basically more employees. We know that healthcare costs are now the biggest cause of economic slowdown for businesses, as well as for labor strife between employers and employees. And In the United States, most corporations for every dollar that a corporation spends, countries in the industrialized nations spend a third less. And as a result, we spend much more on steel to make cars in the US than we do on healthcare benefits for people to build cars than we do on actually steel that's used for cars. So when we look at economic freedom, freeing up the healthcare system would stimulate our economy, it would create jobs, and it would really allow us to climb very rapidly in terms of the economic ladder. Thank you.
Okay, in my last segment, I showed you the practical superiority of markets for creating the prosperity that we need to provide reliable, affordable health care. But economic arguments will fade in relevance if we have a moral imperative to guarantee health care for all. Well, I stated earlier that what makes free markets morally superior is that it is the system that most consistently respects individual rights. Well, what about health care? Isn't health care a right? Since without health care we can die, doesn't the right to life include the right to health care? Well, let's use Hazlitt's principle once again and examine what the right to health care looks like in a single-payer system. In order to pay for everyone's health care, we first must take away the honestly earned property of the productive and put it into a common pool. Hopefully you've learned about the tragedy of the commons. Single-payer and any form of government-financed or government-controlled health care creates a medical commons. And as with community-owned pasture land in the original example of the tragedy of the commons, each farmer who doesn't graze his livestock on the commons loses all and gains nothing. Eventually, the pasture is ruined by overgrazing, or in the case of health care, it will lead to overutilization and shortages and a crushing national debt. The solution, if you're unwilling to return to a system of private property and voluntary trade, is to empower a small group of politically powerful elites to set the rules. These politically appointed panels decide what goods and services will be provided. And he says the doctor, you get all this free choice with doctors and patients. It's not. It's going to be these panels that decide even what is going to be available to you and how much they'll pay for them. That means you are no longer in charge of deciding how much of your own money to spend on healthcare relative to all the other values you have in your life. Instead, that's determined by politics. And in our current system, that includes an awful lot of powerful special interest groups. Patients are told what medical goods and services will be available. After 65 in Great Britain, you don't get the kind of coronary care that you get in this country. Doctors, hospitals, and other providers are told what they can charge for their labor and their products. What's happened to their right to life? What's happened to yours? And since you have to pay for my health care now, you have a valid reason to tell me what I can and can't eat, drink, or smoke, how much I have to exercise, how fat I'm allowed to be, and even how risky of leisure activities I can participate in. So where's my right to my life? And because I get to start making those same kind of claims on you, what happens to yours? So those who argue that there's a right to health care that's grounded onto a right to life flunk Hazlitt's test. It's not a right that can be consistently used. The construction of a right to life, right to health care based on a right to life collapses under the weight of its own logical impossibility. The right to life does not include the right to force your neighbor